Okay, can everyone hear me? I think we'll go ahead and get started. There's been a few stragglers coming in, but we're going to go ahead and get started. I want to thank you for coming today to the public hearing on the proposed rule amendments ARC 2097C that would implement a monthly funding cap waiver services provided to persons on the HCBS Intellectual Disability Waiver. My name is Tracy Larson, and I will be the moderator for this event. We will proceed with this hearing in the following manner. Once everyone who wishes to present comments is signed in on the sheets that were located out in the lobby area before you came in, I will read a brief overview statement of the proposed administrative rule amendment. At the conclusion of the statement, I will ask the persons who signed in to deliver their oral presentations in the order in which they signed in. As this hearing is being recorded, I will ask that each person who does comment to please state your name into the microphone before beginning your comments. Each person will have no more than 3 minutes to present their comments. Persons are asked to limit their comments to the subject matter of the statement that will be read. Please note that as the moderator, I am not allowed to respond to questions on the content of the statement or the proposed rule. This hearing will be limited to no more than 2 hours and will end by 2:30. Written testimony may be handed in today and or submitted via email within 2 business days to Harry Rossander, and you can at D.H.S. and his email address is HROSSAN@dhs.state, spelled out STATE.ia.us. If you provide email comments directly, please type Iowa ARC 2097C in the subject line. Are there any questions before we proceed? Repeat what? His email is HROSSAN@dhs.state.ia.us. The memo line needs to say Iowa ARC 2097C.
Is there anybody here from D.H.S. that can answer questions?
No. Any other questions or comments before we start? Not yet, because I wasn't told to in my instructions yet, Kristen. Okay, I'm going to start the recording and we'll start. I will now read the prepared statement as we follow with your presentations. The purpose of this hearing is to solicit comments on proposed administrative rule amendment regarding the implementation of a monthly funding cap on waiver services for persons on the Home and Community-Based Services, HCBS, Intellectual Disability ID waiver. These amendments implement a cost savings initiative that was part of the basis for the department's budget for state fiscal years 2016 and 2017. It's appropriated by the 2015 Iowa legislature. Each July 1st, the department calculates a daily rate for services provided in an intermediate care facility services for persons with intellectual disabilities, ICF-ID, in the state. The proposed amendments would cap the monthly cost of all waivers provided to a member receiving HCBS ID waiver services, with the exception of home and vehicle modifications, to the daily ICF ID rate converted to a monthly maximum. The microphone is now open for comments from persons who signed in to deliver their oral presentation. We're going to start with Diane.
My name is Diane Schlusselman, and I am asking you to reconsider the ramifications of passing the proposed amendment, Chapter 83, as part of a cost savings initiative for the Department of Human Services budgets for the fiscal years 2016 and 2017, is capping the monthly cost of all intellectual disability waiver services provided to some of our community's most vulnerable population at the maximum monthly cost of services in an intermediate care facility for persons with ID, making progress in our society. Providing services to our disabled community in their homes would become a thing of the past, and the new norm would be placement in an institution. Please help me to understand the logic here. This proposed change would likely exceed present costs and certainly not be going forward in time. I am the guardian for my 55-year-old sister who is receiving supported community living services under the ID Waiver in a Systems Unlimited supervised house in Iowa City, Iowa. My sister Ida Bryson has severe autistic disorder, is nonverbal, legally blind, and has profound intellectual disability. Ida shares a house with 3 other ladies of varying disabilities. The relationship Ida and the other 3 ladies have is a harmonious one. Ida has lived at her current location for over 10 years now. She requires help with all her activities of daily living. Staff needs to be present for her 24/7. The care she receives from staff is above our expectation. Staff not only care for her, but care about her. Ida spends much of her day in her rocking recliner in the living room. Also, throughout her day, she makes multiple trips to the kitchen for a drink of water or to eat a snack, all supervised. If she feels a need to lie down in her bed, she has a quiet room all to herself. As her sister, I know from years past that the incidents involving her becoming agitated have decreased. There is no doubt in my mind that a very large part of this is due to the calm, low stimuli environment she lives in. Ida cannot cope in a setting where many individuals live. Walking out into a hall in an agitated state would be an accident just waiting to happen. With her visual impairment and autism, there would be a high probability of her falling, bumping into something or someone, and thereby hurting herself or another. She would soon find herself being confined to her room in isolation. At mealtimes, she would not do well eating with a large number of other residents, as the noise would agitate her. Ida is in a setting where the ratio of staff to client allows the staff to interact with my sister. They know Ida's cues. Being nonverbal, this is of monumental importance in providing her cares. Regarding physical activity, walking is one of Ida's loves. A staff takes her for walks in the neighborhood in favorable weather or to the rec center when not so favorable. She has also gone to music in the park. Ida has regularly taken grocery shopping to Hy-Vee during less busy hours with the assistance of staff. She enjoys pushing the cart down the aisles with staff assisting and selecting food she likes. Ida's life might not seem to be much of a life to many in our society, but as her sister, I must say, she is content, well cared for, feels safe and loved. Now, can you put a price on that? Thank you.
Next, I have Amy.
Hi, my name is Amy Fite, and I work for Goodwill of the Heartland. I recently started working as a customized job placement specialist as Goodwill embraced the Employment First initiative. With the thought of the Medicaid cap on the horizon, it seems like the Employment First initiative that Iowa has fully embraced is not being taken into consideration at all. The cap would make it difficult to provide the needs for supported employment because many individuals I work with live in a group home, would probably need to go to day hab services for part of the day, and then would most likely need 3 to 4 hours of coaching per day available on the job, which would surpass the daily cap of service. Not only do I come today as a provider, I apologize. But I also come today with a brother who has a severe and profound disability. Oh, okay, this is just really close to my heart because my mom did not want to put him in a group home. My brother David lived at home with my parents until just last year when he was 42 years old. It took many years for my mom to prepare. And it took a lot of research to find a provider like Systems who could meet my brother's needs. That was in a community setting. We visited a lot of institutional settings. Last year, we were able to tour a condo in Iowa City with the Systems Unlimited, and it was a perfect match for my brother. David has 2 roommates and 2 staff at his condo, and he's able to go to day-hab services during the day. My brother doesn't talk, and he's limited to smiling and crying with very limited physical movement, but it's very clear that he enjoys going to day-hab and being with a variety of individuals. If this cap occurs, David's services would be limited to just living in a group home, if that would even be possible, because that cost would need to rise for him to be there 24/7. Thinking about this cap could do this cap could do to my brother, who is incapable of advocating for himself, makes me feel very overwhelmed and angry. I have heard this cap would only impact 360 individuals statewide, and it seems like you've targeted the most vulnerable population you possibly could. I believe there could be many other options to reduce expenses and to penalize those individuals who need the services the most.
Good afternoon. My name is Carmen Wyckoff. I am the sister and legal guardian for Eric Vetter. He is a 43 now, year-old gentleman who lives in DeWitt, Iowa. He lives on $908 a month from SSI and HCBS services. He doesn't have a cell phone. He doesn't have a computer. He only has basic cable TV. And he's lived in his community in an apartment in as independent a setting as possible for the past 20 years. I made my mother a promise on her deathbed that I would support him and keep him in that situation. We were recently affected by this rule. In June of this year, my brother was strongly encouraged to be forced into a group home or institutional setting because all of his HCBS services would not fit under the cap set by DHS. I had to advocate quite severely and ended up having to change care agencies for him because of this ruling. He currently receives SCL services, pre-voc services, day-hab services, and some security system overnight services, which all fall under this cap. It is very challenging to maintain that mix of services for him under such a tight cap. There is no structure in rural Iowa to support independent living for these individuals. It's too expensive for Eric to live independently in a larger city such as Iowa City or Cedar Rapids. By forcing all of HCBS services under one aggregate cap, this administrative rule will effectively force individuals like Eric into group homes or care facilities, segregating them from their communities and restricting their independence, which goes against all of the laws we have in this nation. Cost savings for DHS could easily be achieved through the reduction of bureaucratic waste, such as the SIS process that I recently experienced. The SIS person required 9 of us to sit around the table for 2 hours detailing all of the services that Eric needs. When I asked her what this was going to accomplish, she said, well, of course it will document his needs. I said, and how often will we be doing this? Oh, we do it every 3 years. I said, no, we don't. We've never done this before, and he's 43 years old. If you want to do the math, 9 people times their salary times 2 hours, plus the amount of time that it took to organize that meeting, and just let me say the scheduler was not polite, could easily provide cost savings if you multiply that by over 300 individuals involved. I respectfully request that this rule be rescinded.
My name is Dr. Leah Davis, and I currently reside in Tennessee, where I recently accepted a position of the faculty of the Department of Medicine at Vanderbilt University. I'm the stepmother and legal guardian of Dylan Davis, a 22-year-old young man with autism, intellectual disability, bipolar disorder, and aniridia, who makes his home in Iowa City, Iowa. Dylan never developed speech and cannot speak for himself on this issue, so we've traveled over 500 miles to be here on his behalf today. And although I may be the only one speaking on behalf of Dylan today, I have brought with me the support of 4,541 people, including 3,546 fellow Iowans who have signed our petition in opposition of this rule. Proposal 2097C would cut 1/4 of my son's monthly services budget. Let me say that again. Proposal 2097C would cut 1/4 of my son's monthly services budget. Despite the daily challenges Dylan faces, for the past 7 years, he's lived happily, peacefully, and very modestly in the Iowa City community, supported by Systems Unlimited, Mayor's Youth Empowerment Services. Because of these services, he's been able to access his community, a right guaranteed to him by the U.S. Constitution and the Americans with Disabilities Act. The proposed cut to his funding is not sustainable and imminently threatens his community-based residential services. As I'm sure you are aware, according to the Department of Justice, this budget cut constitutes a well-documented violation of the Americans with Disabilities Act. For the education of others who may not be aware, I have brought with me today, and have copies for anyone who wants one, a statement published by the Department of Justice Civil Rights Division on the enforcement of the integration mandate of Title II of the Americans with Disabilities Act and Olmstead, wherein they specifically address state budget cuts. Reading from that document, quote, "Budget cuts can violate ADA and Olmstead when significant funding to community services create a risk of institutionalization or segregation. The most obvious example of such a risk is where budget cuts require the elimination or reduction of community services specifically designed for individuals who would be institutionalized without such services. This mandate has already been tested in other states. For example, from Smith v. Department of Public Welfare of the Commonwealth of Pennsylvania, the Department of Justice published this statement. Quote, "Individuals who are at risk of entering an institution because of a state policy need not wait until they enter the institution in order to assert an ADA integration claim." Pashby v. Delia, MR v. Dreyfus, Fisher v. Oklahoma Healthcare Authority. In Fisher, the 10th Circuit held that disabled persons who stand imperiled with segregation could bring a claim under ADA's integration regulation without first submitting to institutionalization. The court reasoned that there is nothing in the plain language of the regulations that limits protections to persons who are currently institutionalized. The court concluded that the integration mandate would be meaningless if plaintiffs were required to segregate themselves by entering an institution before they could challenge an allegedly discriminatory law or policy that threatens to force them into segregated isolation. Serious risk of institutionalization may be established by evidence that the lack of sufficient state-sponsored community-based services will likely cause a decline in a plaintiff's health, safety, or welfare that would lead her to eventual placement in an institution. As I sat down to write this statement that I would read today, I asked myself, to whom should I really address this comment? Could it be that the Department of Human Services, an organization that has faithfully and capably served Iowans with disabilities for decades, actually submitted a proposal to defund itself that clearly violated the Americans with Disabilities Act? If so, we may have bigger problems in this state than it appears. As public outrage over this proposed rule has grown, we've witnessed some hedging about who would be affected. In a statement to the Daily Iowan, a DHS spokesperson said an estimated 350 people would be affected by the cuts. In the minutes from the recent Administrative Rules Committee, another official said it would be 600. So we might be provoked to spend time trying to figure out, why don't these numbers match up? How many will it affect really? Who are they? But this is a red herring, a distraction. It doesn't matter if it's 6 or 600 who will be forced into institutional settings when they lose their current community-based services. When one person's disability rights are impinged upon by the state through massive cuts, it's an assault on the civil rights of every single citizen in this state. We don't have to wait to find out how many people will be segregated or who they are before we file ADA violation claims. And frankly, if this proposal is passed, you can bet we won't.
Next is Bob Williams.
Good afternoon. My name is Bob Williams. I'd like to talk to you about my 27-year-old medically fragile son who lives in a group home here in Iowa City with Systems Unlimited. My wife and I visit Michael weekly. Every time we visit him, we're just flabbergasted by the dedication and expertise of his staff. I'm talking about 3 men with complex medical needs that would tax the stamina of most dedicated health professionals. The staff that works in this home comes in for their shifts with enthusiasm and often are greeted by Michael, giving them big hugs and exulting how happy he is. In addition to the intense personal and caring interaction between Michael and his staff, let me make it clear that Michael's health has measurably improved. He's gone from being in the ER more than any of us would like to think to just being in the ER twice in the last 9 months for very brief visits. His diet is vastly improved since there's enough staff to delegate tasks. While each resident's needs are confidential, my understanding is there's one person in charge of the house who does all of the communication with medical professionals, be they doctors, nurse practitioners, RNs, or dietitians. And the general communication is then handed over to the administration of systems. That particular coordinating staff also works a few weekly shifts at the house to ensure that he knows firsthand what's going on. The remainder of the direct care staff are carefully organized into teams that are able to support one another, bounce ideas off one another in case there arises some sort of non-emergency sort of situation. Since Michael's current level of funding exceeds the cap, let me ask you, how will systems handle the intense medical needs of Michael and his roommates? I'm presuming that staff will need to either be cut or staff salaries will need to be cut. I confidently, but very unhappily, predict that there would be severe medical repercussions. Let's look at Michael's employment at Employment Systems. When I've been there during the day, I see dozens of staff actively involved with the clients, enthusiastically engaging with them in a variety of activities. There's a sensory room plus many other rooms and activities that I can't even begin to describe. Craft projects, technology, music. The atmosphere is exciting. The consumers are learning. They're productive. They have opportunities to go out into the community and practice social skills, as well as expand their experiences in ways that would be difficult without the support of employment systems and its dedicated staff. Let me ask you, what repercussion is funding going to have on Michael and the consumers like him? Which parts of the programming would have to be cut? Would he no longer be able to go swimming or go to the animal shelter? Would he be unable to participate in crafts? Would his hours be cut and his one-to-one goals of reading and social skills be left behind? As I look at the hard, cold facts that this proposed funding cut involve, here's what I see. Reduced staff at Michael's home with potentially lethal implications for medical safety, as well as deterioration of social and cognitive development due to fewer staff interactions. Reduced staff and reduced hours at ES with resulting deterioration of social skills, emotional development, and practice interacting with the community. The bottom line question is, why is this being proposed? Will the funds that are saved really make a difference in the grand scheme of Iowa's budget? Why start with the most vulnerable population for fund cutting? Do these individuals really matter? If this amendment passes, I believe my questions will be answered in a way that I most fear. Thank you.
Next I have Scott
Weezer.
Waiver.
Yes.
Okay.
How does it stop?
I just want to make sure it's okay. Right there. I don't know.
It's going to read right off of this. Hi, everybody. This is Scott Weezer. He works for Systems Unlimited, and he'd like to say a few things to you today.
I am afraid of the caps affecting the number of staff on a shift. And that will cut into the care we will get plus the outings we can go on. And that will cut into the care we will get plus the outings we can go on. I have been a part of systems going on 27 years, and the personal attention we all receive is second to none. I require total assistance of all of my cares, and see many more people in systems who are in the same boat as I am. In short, these cuts will end up doing more harm than good. Thank you for hearing me out. But I hope you were listening to me. I require total assistance of all of my cares, and see many more people in systems who are in the same boat as I am. I require total assistance of all of my cares, and see many more people in systems who are in the same boat as I am. Is this the example that Iowa wants to give to the nation? That people with disabilities don't deserve the same chances as other people? I have been a part of systems going on 27 years, and the personal attention we all receive is second to none. Thank you. For your Thank you for your time.
Thanks, everybody. Good job, Scott.
Okay, our next speaker is Jody Tate.
Hi, I'm a psychiatrist here in Iowa City, and I've been working with individuals that have challenging behavior, mental illness, and intellectual disability for over 10 years. And it's not easy for these individuals to sometimes succeed in the community, but secondary to amazing agencies in our community and throughout the state, along with the incredible employees of these agencies, they're able to maintain a full, happy, meaningful life. But my concern is if this cap is put in place, many, if not most, of the patients that I individually work with, their placement will be at risk. And if that happens, I don't know where these individuals will go. I don't think there's a lot of places in the state for individuals to go because there's not a lot of capacity. So I do not think the right for individuals to live a full, meaningful, happy life in the community should be a budgetary decision. I think it should be an individual's civil right, and I respectfully request that the cap not be in place. Thank you.
Okay, that's all I had that had the marks by their names who said they wanted to speak. Was there anybody else that wanted to speak? Okay. Oh, it's not on my list. You can come on up, though.
Hi, I'm Kim Majerus, and my son Colin, who is 26, has special needs. He lives in this community, although he was born and raised in the Owine community. I have several points that I really want to make. The one I want to start with, because I think the cap really addresses this, whether you're staff or you're a medical professional, or you are family, friends of people who need these services, we all work every day to provide a delicate, and I emphasize that word because of my experiences in the past 26 years, a delicate balance for each of our loved ones for the services that they receive. Colin transitioned from home when he was 15. And it was appropriate at that time because he, although has a moderate to severe mental disability, has a minimal physical disability, and the options for him academically in a high school were going to be to go to a severe and profound center. And he's very social, so I really wanted him to be in another environment. So I spent around work and life as a single parent of 3 boys doing research throughout the state, and spent about 400 hours over the course of about a year and a half looking at all the options, and then choosing what I thought was the best option, and then of course modifying that and modifying that and modifying that. So he went to West High here, and he was with REM at the time in a group home, but he has ADHD to the severe level, and so being in that setting was not appropriate for him. He does have aggressive behaviors, although when in the right setting, those are minimized to probably less than 5% of his total picture. We then went from a group home into an assisted living apartment, which some of you have spoken about and works well for some. For him, it still stimulated lots of behaviors. We had lots of ER visits, whether it was from someone hitting him back or hitting him first, and causing, problems for him. So he now is with Consumer Choices Option, which is another part of what is under this cap. And it allows him to be in his own apartment, which works so much better with staff. He also goes to employment systems in the morning and does some employment opportunities. He goes to Mayor's Youth Empowerment Program in the afternoon for the recreational aspect of his life, and then has one-on-one staff through his evening and into the night to the next day. He is incontinent of bowel and bladder, so requires someone to assist him. He would not be safe by any means in cooking, crossing a street. He has a rare brain abnormality that has him not being able to balance his logic and emotion. So from a safety standpoint, if he saw someone he knew across the street, he would run into the street for emotion and then get halfway across, if he made it, before he would think, oh, by the way, I was supposed to look both ways. So that, constant impulsiveness is there. So he needs someone with him, needs someone to care for him. So, and I guess I tell you that story because it is a delicate balance, and that's only the portion of his living that is part of the delicate balance. It's the medications, a long list of things that we've tried and have worked and that we've modified, and we're still in that process as he seems now to be at age 26, realizing what it is to be a young male. So, there are always those balances that we are trying to obtain. And I guess it is so hard for me, and I don't know if I said this, but I'm a physical therapist, and I have actually professionally served as an advocate and a lobbyist in the past. And I don't understand how, when all of us in this room work so hard to find that balance that provides not only the needs, but the rights of that person to have happiness, that we can have a government, whether it be local, county, state, or federal, that is going to interfere with that and tell us that we don't know as much about our loved one or the person we work with as what they do. And so I just really implore the state to take another look at this and to realize that all of these people do have the same rights and that it is such a delicate balance. Please don't upset that. Thank you.
I think I saw another hand, yep.
I apologize, I didn't realize I was supposed to check a little checkbox. Thank you. My name is Patricia Williams. I'm married to Bob Williams, who spoke a few people ago. He gave you part 2 of our plans, so I'm going to fill you in on the beginning part. Our son Michael is 27 years old. In early infancy, Michael started to show signs of developmental delay and physical challenges. He was diagnosed with developmental delay due to unknown etiology. He lived at home until shortly before his 9th birthday, at which time his health needs far exceeded our ability to keep him safe at home. At the time, there were no appropriate pediatric facilities in Johnson County. My husband and I were devastated. I kept trying to explain to our wonderful social worker through D.H.S, no, you don't understand. We would like Michael to stay in Johnson County. And she finally managed to explain to us there are no places for him here. So 2 days before his 9th birthday, Michael moved to an ICFMR in Waterloo. At that time, he was the only child on a floor with all adults. After 2 years, we were able to move him to a pediatric ICFMR outside of Des Moines. That makes 9 years he lived in an ICFMR setting. And I'm here to agree with people who express fear. My husband and I have lived the nightmare, and your fears are warranted. Fortunately, and very happily, we were able to move him to Johnson County on his 18th birthday, which was the first possible day he would be eligible for adult services through the home community-based service, ID Waiver. He currently lives at a wonderful Systems Unlimited home, and he works at Employment Systems. Clearly, I am concerned about the proposed cap in funding. Michael's current funding exceeds the proposed cap. Even though at the moment there are no plans being vocalized to move people back into institutional settings, I think we must be very, very cautious, and I think we must not take this possibility and think it doesn't exist. My experience has been this is the first step on a very slippery slope. So let me clarify for you what having a child live in an institution for 9 years meant for our family. My husband or I, either one of us, we did it in shifts, visited Michael at least 40 Saturdays a year. If we do a conservative estimate, and this is conservative, this is very conservative, of a 225-mile round trip each time, that would be 40 times a year for 9 years. We drove at least 80,000 miles to visit our son, who knew precisely that he was not at home. He knew we were sleeping in our beds. He knew we were far, far away. He knew he wanted to see Mrs. Lang, who lived next door. He knew he wanted to see his friends. Imagine the impact that this had on our family life. Imagine the impact this had on Michael's brother. An institution can in no way provide a family environment. Every human being needs to be part of a family in a close, loving environment in order to thrive. In Michael's case, as I mentioned, he was fully aware that he was nowhere near home. How many personal and meaningful interactions can the most dedicated staff working in an institution have with each individual of the dozens who live on a unit? Our experience was that staff had limited opportunity, not limited interest, but limited opportunity to monitor Michael for minor health changes. And as someone who is medically fragile, a minor health change can turn into a major medical event overnight. During the 9 years that Michael lived in an ICFMR, we received several phone calls letting us know things such as, and these are quotes, these are emblazoned in my memory. Well, we neglected to follow such and such medical protocol this morning, and we almost lost him. Did anyone mention to you that Michael was discovered unconscious 2 weeks ago? We haven't been able to find his glasses for a week. We just realized that. Might you have a spare pair somewhere at home? When we were able to move him to Johnson County on his 18th birthday, he was sick. He was very, 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 very sick. And in fact, he was admitted almost immediately to intensive care at university, which followed 3 days of frantic tests to try to figure out what was wrong with him. Eventually, it was discovered that the little cold that he had been diagnosed with had perforated a lung. He was on 10 IVs, 10 antibiotics. Is this the future Iowa really wants? So let's give Iowa the benefit of the doubt. Let's presume that we're not looking at moving people into institutions, but keeping them in whatever their current environment is that's appropriate for them. In Michael's case, Systems Unlimited. Would there be any negative consequences resulting from a financial cap? Yes, there would be. There's a certainty of a reduced staff to consumer ratio, both in the residential setting and the work in the recreational setting. Since Michael has lived in Iowa City with the ID waiver funding, I'm no longer chronically concerned that he's well cared for. His health has dramatically improved, dramatically improved. People who knew him before and see him now say, this is a different kid. I never would have guessed he could be so healthy. His cognitive development has increased by leaps and bounds. We have full conversations with him now. He uses words like finished. He'll say behind the tree. On Sunday, he said to me, so Mom, how was your day today? So it is a gift. And this is the result of skilled, dedicated staff who are well trained. They're not just care providers. If we reduce the funding, we're going to move backwards. It's inevitable. I agree with other people who say they're unclear as to the purpose of this proposed amendment, other than to save money. If this is the case, let me ask you, what is the philosophy of the state of Iowa? Seriously, does this state view this population as the throwaway population? Does this state think these people are so cognitively out of it that they have no idea where they are, what condition they're in, where they want to be? I have one last thought. It's a very painful one. Anybody who's in this room who does not have a family member, or maybe watching this video, who does not have a family member who would be directly impacted by this cap. Let me tell you, I recognize it's human nature to think that will never happen to me. Well, it could happen to you. I hope it doesn't, but it could. Accidents happen. Challenges during birth happen. Genetic problems happen. Things can go wrong for no apparent reason. Any person listening to me today can 1 year from now have a loved one who needs intensive help. Let's be a state that continues to lead for those who are truly unable to arise beyond insurmountable challenges. Do not pass this amendment. Keep the full funding. Thank you.
Yeah, it still had a little. Okay, was there anyone else that had comments? We have 2. Okay, we'll start with you and then we'll get you next. Oh, okay, 3.
Hello. My name is Casey Westhoff, and I'm Executive Director of Systems Unlimited here out of Iowa City. I'll just cut to the chase today. Commentary at the September Administrative Rules Committee on this rule reads, a DHS representative explained savings by this rule would be at least $2 million annually. People affected would be primarily those who are not going to be transferred to MCOs and would still be affected by rulemaking. It was implied by the Department of Representatives that were there that there was an overreaction to this rule, as most people would not be impacted. DHS should be here today to answer some of our questions. That said, if you walk in the shoes of a provider who serves a significant number of people who currently have monthly services over the ICF ID cap, this will be a significant issue. We still don't know or have clarification as to what the department and MCOs will base provider rates when contracts are established. If the floor of a service range is used as a basis for MCOs to make payment to providers, would that possibly be the ICF ID capped rate that is being proposed? If payments are reduced to providers who have been willing and are willing to serve some of the state's most vulnerable population, decisions obviously will need to be made as to if we need to cease providing or reduce services to some individuals. Systems Unlimited has been a long-time partner with the state of Iowa and has stepped up to serve people who have significant medical and behavioral challenges. We and other like providers are a major reason why the state is at least making some progress in compliance with Olmstead and balancing institutional cost with community-based care. This proposed rule change and other decisions by DHS target the state's most vulnerable population. Simply put, this rule was not accurate in its savings estimate, as providers will not continue to serve people in small community-based settings. It will also have far greater consequences if MCOs are able to use the capped rate as a basis for payment. I ask that you rescind the proposed amendments to Chapter 79 and Chapter 83. Thank you.
Hi, my name is Ariane Wassine. My daughter, Audrey, who is on the waiver, is only 8 right now, and right now the caps wouldn't affect her. But she's a sweet kid. She loves music. She loves going to the library. She loves going out in the community. And I want to know, when she gets to be an adult, and once me and my husband aren't able to care for her anymore, I want to know that these services are there for her. She will always probably need one-on-one supervision. She will probably always be incontinent. She will probably... But she loves people, she loves being around people, she loves being in the community, and I hope that Iowa will help kids like her and make sure that they have a future. Thanks.
My name is Roger Lusal. I'm the Executive Director of Mayor's Youth Empowerment Program. As a provider of services to many members who this rule will affect, and the implication of the implementation of the proposed rule are enormous proportion for several reasons. With the implementation of the cap, many of the members that we serve, 41%, will be losing some type of their services, if not all. Whether it be a complete elimination of their day hab services, many of the members that we serve, they have become accustomed to going to system in the morning, coming to Mayor's Youth in the afternoon to complete their day. This will affect their services. The implementation of the cap is in total contradiction of the ADA Act and the Olmstead Act. So today, we ask the department to rescind this rule. Thank you.
Okay. Is there anyone else after?
This is a little tall for me. I'm sorry. I actually didn't realize I needed to check next to my name. I didn't intend necessarily to speak when I came in, but as I listened, it became apparent to me that I need to speak for my aunt who can't speak for herself, and her sister came to sit next to me. She doesn't. My name is Jennifer Hahn. I'm sorry. And my aunt Sylviane is here with me, sitting with me, and supporting my Aunt Vivian, who was injured in a car accident when she was 8 years old. She receives a number of cares from Systems Unlimited, and she will be impacted by this rule, perhaps not to the full extent that some individuals will be, but I know that she will lose out on something, whether that's simply her day services or the transportation service that's provided to her to get back and forth, or whether that's a level of cut staffing at home. This is something that's very uncomfortable for me to do, but I thought that it was important that I get up and say, and ask DHS to please reconsider this amendment. I do not want to see my aunt negatively impacted. Thank you for your time.
Okay, one last call. Is anyone that wants to make a comment?
I do.
You do?
I do now.
Okay.
It's very short. I am Jennifer's Aunt Sylviane. My name is Sylvia Smith, and I was 13 when my sister Vivian was hurt. We helped take care of her. She's been in the system for over 40 years. So I truly know what this means for her. My problem with this cut is that it will impact the people that have no say, no control over their lives. And I find it very, very difficult to see social services, welfare, food stamps, all of this go to people who are perfectly capable of working, where these young people, not necessarily even young people, these people would give anything to go out and work their bodies to the bone. But they can't. Not mentally, not physically. They just would. And to cut their services is so, so wrong. Thank you.
Okay, if that's the last person that wishes to have any comments, I'm going to thank the participants for their comments. Oh, one more? Do you want to speak?
Maybe, unless you want to, Chris, you're probably more fit for this one. Absolutely. Thanks, Adam.
I wanted to I wanted to say that Goodwill and Dayhab is good for me, and that I like it, and I don't know.
Would you be impacted if you could
Yes, impacted, and it's hard for me to comprehend stuff, right?
Can I talk a little bit about what your life was like before you had some day programming?
Okay.
And a little bit about your diagnosis?
Oh, yes.
when Adam was first in systems, he didn't have a whole lot of day programming, and he didn't have a whole lot of going on, and he had some significant health issues that kind of kept him from being able to participate daily in things for himself. Since we've been able to figure out some of those medical issues that impacted Adam on a daily basis, and also tackle some of his depression issues and keep him rolling along every day, he's been able to start going to Pathways and Goodwill, and we've seen those services assist him in staying active and being happier and feeling better about himself on a daily basis. And so seeing those things go away because of this cap. And Adam lived on his own for years and years and years, and only after a brain injury sustained due to a stroke and drowning incident did he have to come into services at all. So seeing him be able to come back and go this far to the point that he's walking again is a big deal, let alone that he gets to enjoy his life and is, staving off depression by having social outings and having activities and things that he can do every day. So we really hope that you rescind this cap and that he can continue to do everything that he would like every day and help his, personal well-being.
Yes.
Thank you.
Yes. Good job, buddy. Okay.
Yes, in the back.
My name's Renee Jostad, and I've been sitting back there debating on whether to come up and share this or not. It's not a story about my son or anything like that. I'm sure most of you, are sick to death of all this crap. To be blunt, I'm blunt. I have written, I don't know how many letters, emails, everything, to congressmen, to department heads, to everybody. I have one state representative who is listening, who is helping. I got an email from her yesterday saying that she has talked to several department heads at the state level of DHS who have told her they do not plan on filing this. So this really will not go into effect. I also know they say things and then they do something else. I have another girlfriend in Des Moines that emailed me just 2 hours ago saying that she has a senator who is helping her fight this, also has taken an interest. He has set up a meeting with his staff, Charles Peterson, the head of DHS, I think he is, and her, about this. So I would just like to encourage everybody to really go after your senators and your representatives right now. I mean, push them. Push them, write them, bug them to death. A couple of the emails I have sent out to the representative that is helping me have not been real professional. I will admit that. She still responds, and she's been wonderful, but let's really push. Let's really push them right now, and let's hold their feet to the fire and fight for what our children need, because this whole cut is going to be detrimental to my son like everybody else here. And so I just want to encourage everybody to please right now push. Just push. Okay, thank you.
Okay. Once again, I'm going to thank everyone that participated for their comments, and I will conclude the hearing today. Thank you.